Respected colleagues, the business of the day is presentation of one bill. I now invite the clerk to read the short title of the bill.
Point of order. The point of order is order 8/4, motion of urgent public importance. If I may, before we go to the bill.
Yes, sir.
Mr. Speaker, my name is Gbajabiamila. I have a motion of urgent public importance on the need for the federal government to adopt emergency measures to protect the people and economy of Nigeria from the potentially dire consequences of a widespread outbreak of the coronavirus disease amongst the population. Mr. Speaker, that is my motion.
Seconder.
Mr. Speaker, honorable colleagues, the House notes that the COVID-19 disease caused by the novel coronavirus has emerged as the most significant threat to the physical, mental, and economic well-being of the people and nations of the world. The House also notes that the alarming levels of spread and severity of the disease will cause the World Health Organization to rightly classify the outbreak of the COVID-19 as a pandemic, as the spread of the disease has now reached every corner of the world, with 341,000 recorded infections and 14,700 deaths globally. These numbers continue to increase rapidly, almost on an hourly basis. The House further notes that the novelty of the disease combined with its rapid spread has caught the world almost unawares, and there is, for the most part, no pre-existing framework for managing the short, medium, and long-term consequences of the pandemic. As such, we are left to adopt and implement emergency measures on the fly, and in the expectation that our efforts may help to avert the worst consequences of this new threat. Mr. Speaker, honorable colleagues, the House is disturbed that the existing healthcare framework and facilities in the country are not sufficiently robust to provide an effective and life-saving response in the likely event of a large-scale outbreak of the COVID-19 disease within our shores. We do not have enough hospital beds, intensive care units, respirators, testing kits, thermal disinfection equipment, and personal protective equipment. We are also short of the numbers of medical personnel required to manage a significant national outbreak of the disease. The House is also disturbed that, as has been seen from events around the world, a full-scale pandemic of this nature inevitably has a devastating effect on the flow of commerce, the development of industry, and the economic outbreak of a nation. In the event of a large-scale outbreak here at home, we cannot reasonably expect not to experience the same. We risk job losses on a massive scale. We risk also severe economic misfortune for the vast majority of our people. The House is aware that we now have a very limited window of opportunity to act to first prepare ourselves for the possibility of a large-scale breakout, then to ensure that we have in place an emergency healthcare system that can accommodate such an outbreak, and finally, to build sufficient economic resilience so that our people have sufficient cushion to survive through the worst. The House is certain that if we, in our capacity as representatives of the people, are determined to act quickly and of one accord, we have it within our power to avert some of these consequences and ensure that we cushion the worst effects of this emerging crisis in all its dimensions. The House is cognizant that our interventions at this time require the full cooperation and support of the executive arm of government, without which not much will be achieved. Therefore, we will seek to act in unison, making sure that our interventions complement the actions already being taken by the ministries, departments, and agencies of the government, and support the plans already in place. Therefore, the House resolves to demand that the Federal Ministry of Health and the National Center for Disease Control rapidly scale up testing capabilities through the establishment of nationwide testing centers so that we may begin to determine the actual numbers of Nigerians who are already carriers of this COVID-19 disease. 2, to direct the Federal Ministry of Education to immediately make available hostels in the now vacated federal government colleges across the country for use as emergency care centers and isolation units by the Federal Ministry of Health and the National Center for Disease Control, if it becomes necessary to do so, to manage high numbers of people requiring the treatment from the COVID-19 disease. 3, to mandate the Federal Ministry of Health and the National Center for Disease Control to immediately develop contingency plans for the establishment of emergency care facilities at the federal government colleges. These contingency plans should include cost estimates for the provision of equipment, material, medicines, and other such requirements as may become necessary. To further direct the Federal Ministry of Health to work with the Association of General and Private Medical Practitioners of Nigeria and other such stakeholders to develop plans for the deployment of a core of doctors and medical professionals to these emergency care centers as the need arises. To urge the Central Bank of Nigeria, as part of its policy measures in response to COVID-19, to act urgently to fully fund the establishment of operations of these emergency health centers across the country. The House further resolves to invite the Governor and senior management of the Central Bank of Nigeria to brief the leadership of the House on the details of the Central Bank's policy measures in response to the COVID-19 outbreak, including the procedure and requirements for the disbursement of earmarked intervention funds under the emergency policy measure. And finally, the House resolves that the House commends the actions thus far taken by the federal government of Nigeria to prevent the occurrence of COVID-19 pandemic in the country, and further assures that the House is fully committed to supporting these efforts. I so move, Mr. Speaker.
Seconder. Gbajabiamila Muhammad, I represent Sabagari Federal Constituency. I rise to second this very important motion as moved by Right Honorable Gbajabiamila. I so second. Thank you. It is the view of the House that will put a question. Well, Falaki.
Orientation centers in case in all over the country. NYS National Youth Service Orientation Centers in all the states. As isolation centers in addition to the federal colleges of health.
Respected colleagues, my name is Rep. Oriyomi Ononuga. I represent the fabulously united people of Ikenne, Shagamu, and Remo North. I'm from Ogun State. I rise to second the motion ably moved by Honorable Falake. The amendment ably moved by Honorable Falake. I so second.
Against any.
I should degrade the member representing the federal constituency. I come from Ogun State. My amendment is any suitable structure, whether federal or state, that is suitable to serve for the purpose. I object to the use of federal government college because the schools have staff quarters and they are not in good shape to be as isolation centers. So my secondment is any federal or state structure that is suitable, that can serve for that purpose. I so move.
Honorable Bamidele, those against say nay. Let's have it.